So it looks like we have 5 on right now, and it's 8:30.
All right. Well, we'll go ahead and get started then. Good morning, everyone. This is Meredith with Villagin, and I'm excited to have this call today where we'll be discussing planning for another in-person spring conference. Inca and CDPHE did such an amazing job with the conference last year that I thought it would be worth getting all of your feedback to inquire about topics that would be useful for you. So that's the whole purpose of our talk today. Oh, let's see. I'm sorry, I have to reorient myself to the new WebEx page here to get to the next slide. There we go. And I'll hand it over to you.
Awesome. Thank you. Hi, everyone. Good morning. I think most of you know who I am. I'm Inca Taku. I'm here at the Colorado Department of Public Health and Environment. And Meredith Cook and I host these sharing calls because of the low prevalence of diabetes education amongst Coloradans affected by diabetes. We host these sharing calls hoping to partner with you all, allowing also for you all to network with each other on barriers to GSMES utilization, share successes, identify tools that may be helpful in increasing utilization throughout the state. And so these calls are intended for those in ADA recognized or AABE accredited program staff, but this call is open to anyone that's also doing diabetes education. So all are welcome. Meredith? So just a couple of housekeeping rules real quick. Please keep yourself muted by selecting star 6 and then unmute by selecting star 6 again. Please don't put your line on hold. Sometimes we'll listen to hold music, so if you need to jump off the call, just hang up and call back in if you want. State your name when speaking. We really encourage in-depth sharing, so step up. If you tend to be on the quieter side, step back if you tend to vocalize a lot. But if you prefer the chat box, that feature is available on the right-hand side. You can chat about some questions. And then this will also be recorded, and I always share the link with the comments in a few weeks.
All right. So this trajectory is about to change, or we can get this updated because you'll see if we look at where we've been on these sharing calls, we've been together for a little while now. So started out with a survey monkey on topics that you all would be interested in covering on these calls. And we did a series on the DSMES business plan guide according to that. And then Inca put together the spring conference last year, and we received great evaluations and feedback from those evaluations in the conference. Used that feedback again to inform what we cover on these calls, and now we're launching into the phase of hearing from you for planning another conference. So just trying to be mindful of using what's of value to all of you to inform what we talked about together on these calls. So our ultimate goal there at the top of the slide you'll see is really to just increase the utilization of the wonderful services that you all are providing and just help strengthen the sustainability of those services in Colorado. All right, so I know we've heard from a few of you. If you could show us where you're at. So I know we have Kim on the line, Roseanne, Jenny. Who else do we have on the line that we haven't heard from yet this morning?
This is Yvonne.
Morgan. And Morgan from Good Sam.
Lisa from Good Morning. All right, I heard Yvonne, Morgan, and Lisa. Anyone else? So to place your arrow on the screen, if you left click on the little squiggle line on the left side of your WebEx screen, and you'll see an arrow at the top. If you left click on that, it'll give you an arrow. Just drag and drop your arrow to where you're at on the map and left click. Very good. So we've got some good coverage across the state, which we always like to see.
So we always like to have call objectives just to drive the conversation, and today it's just a pretty basic one: facilitate a brainstorm session on topics and resources for the Spring 2019 Diabetes and Cardiovascular Conference. So we'll do a polling question. So if you just give me a second. Okay, so with the polling question today, we just like to engage everyone on the call. And so which thing would you be interested in learning more about as part of each learning session? And so kind of think of this more as a theme, not the actual topic. And so would you like health equity to be an overall theme, social determinants of health, quality improvement, partnership building, or sustainability? So I'm going to open up the poll. You're all going to have 30 seconds to respond, so select one of the responses and be sure to hit submit. And in about 20 seconds, the poll will close, and then we'll look at the results and then move on from there. And I think, Morgan, you're not on WebEx, right? I think I saw you just called in.
Yeah. I'm just calling in. I don't have a computer right now.
That's fine. Do you feel comfortable sharing what your answer would be?
Yeah, I think the partnership, right?
Partnership
Is
building?
that one?
Yeah,
Yes.
that's one of them, partnership building.
Yes.
All right, so the poll is closed. I'm doing this for the first time, so poll results. So let's see what the results are. So,
Because I've been able to, for some reason, it wouldn't let me fill out the poll.
oh, okay. Which one would you select?
Quality improvement.
Partnership. Quality. Can you all see the results on your end now?
Yep, I can.
Anyone else?
I can see it.
Perfect.
Yes, I can see it.
So we have one for health equity, one for social determinants of health, one for quality improvement, one for partnership building, and 3 for sustainability. So just a mix of all of them. Great, thank you. The reason why I asked is I went to a conference last week, and what I really liked about this conference was that they had an overall theme of health equity, and then each learning session just had health equity embedded within that learning session, and so it kind of allowed you to think through the whole conference and kind of that overall theme. Even though the learning session was very, very specific to a topic, it kind of just tied it back. So I was just curious of what everyone is interested in for the spring conference. So moving on, so I really just wanted to take this opportunity to have you all just share with me kind of your wishes, hopes, dreams of topics that you would like to learn more about, re-engage in. It could be anything. And so the way I wanted to structure this call was first, just have everyone give me topic ideas. And then once we kind of come up with some topics, we'll move across the screen and fill in the other boxes for speakers, materials, and skill learned. So I'm just going to, for the next 15 minutes, I'm going to open it up to you all. And Meredith will take notes.
And can I ask a quick question?
Yep.
I know we have a spectrum of program status on the call. So just thinking about those organizations that don't yet have a program, then we've got some programs that are currently in the process of developing programs, and we have some that have had programs for a while. So are you looking for topics along that entire spectrum, or are you looking for topics assuming it's directly related to an active ADA and AAD program? Does that make sense?
It can be anything. I think that the topics, we're all doing some sort of diabetes education, whether you have an accredited or recognized program or not. And so I think it's really, it could be a topic of trying to become accredited or recognized, and so we could have a breakout session on that. It could be something very specific about, quality improvement. And so right now, it's for anyone and it's open.
Perfect. Thank you.
This is Jenny, and I'm wondering about a topic. I recall, it's been a while, but maybe a year ago, there was an article, and it was actually interesting. I believe it was through a community health clinic in Oregon. It might have been in the Portland area, where it was a completely just an alternate way of funding a diabetes self-management program. I believe that they use more of the accountable care model to fund their program. And I would be very interested just to find out a little more about how they designed the program. I could probably provide the name of that or, locate that article.
Yeah.
But I thought it was a great model.
This is Roseanne. I don't know if this is appropriate for this program, but I think it would be great if somehow as a group we could learn how to develop public service announcements about the importance of diabetes education that could maybe be put out on radio, TV, et cetera, hoping to get more people with diabetes asking their doctors for referrals to diabetes education programs.
Perfect. That's a great idea, Roseanne. Same with you, Jenny. This is your wish list. So there's no right or wrong answer.
This is Yvonne in Trinidad. I was listening to, I think it was Mary Ann's thing the other day on, anyway, she talked a lot about, time management. I think I would like something on time management because she is blocking off so much time for each part of when you do DMS, and it doesn't match what I do. I mean, I am actually probably double that time. It takes me probably up to 40 minutes to chart on a patient after I've seen them. And then to transfer that, of course, to the physician.
Just strategies of how to organize your time for 1 hour class, like how many hours it takes to prepare for that actual one billable hour.
Also, just seeing patients one-on-one too, not just the classes, but yeah, classes included and the seeing patients, and then the documentation after.
So streamlining that process so it's a little bit faster.
Yes.
Ways to do that. Okay.
This is Roseanne. I'm sorry to bother again, but I just had another idea, and that is with the number of technological advances that are happening, I would love to hear about successful telehealth programs and how people are using pumps and meters and CGM downloads, to either streamline or better inform their practice.
Roseanne, this is Meredith, just to make sure I'm capturing that correctly. The pumps and CGM sitting within telehealth or two separate topics? Telehealth. Yeah. Okay.
Yeah. So telehealth is one, and then the other one is using technology, and how people are doing it. Like, for example, in our program, we try to download and use reports whenever possible, and we've had some difficulties with that lately. And so I'm curious if other programs are doing that and what's working well and what's not working well, that type of thing.
Thank you.
Yeah, I think that would be great because we're just getting familiar as a rural area with the pumps and the CGMs, and that would be great to inform like how we get them covered, who covers them, how we go about all that. Because we're just like digging our way through that right now.
This is Kim, and we're doing something new down here in Durango. We started a diabetes wellness clinic where we're actually going into the clinic on a day where the providers are seeing patients with diabetes, and we're helping them with the download and kind of doing a quick review summary. Of course, we don't get our 30 minutes with our patients, so we're not billing for that service, but it's working out really good, and the patients are really more engaged now that they feel like the physician is actually paying attention to their downloads a little bit. We've been doing it for about 3 months as a pilot program in one of our clinics and moving it into one of our other clinics, hopefully here very soon. So not exactly sure. I guess my question then is reimbursement. If there, is there other reimbursement codes we can use other than the DSME to move forward with making these wellness clinics work?
This is Giovanni getting Trinidad. I would like also something maybe about transitioning your inpatients to outpatients. Of course, here in a small area, we do both the inpatients and outpatients, and it is hard to get them to come to the outpatient appointments. And that readmission, how to help the hospital with those readmissions.
This program, I would second that. Even being in a very urban hospital, we do both inpatient and outpatient, and just the challenges of, the limited ability to do education when somebody's in an inpatient setting and then trying to get them in as an outpatient. We're having the same problem.
This is Jenny. I'm sorry. Go ahead. No, you go ahead, Jenny. Kind of related to the downloading, I agree with the downloading with the CGM or just with glucometer results, how to download this and how to, kind of bill for that, and to, just find a way to make that work with the EMR system at a specific site. And I'm kind of wondering, too, if there's a way to feature maybe some of the resources with AADE, with the Dana, some of the technology resources. This is Morgan, and I just wanted to see if there's a way that just ideas or a speaker about how to get more support. Like, our program is an educator-only program right now, and we're just a new program, so we're really kind of grassrooting around our area to try to get physician referral. We're part of a hospital, and I do inpatient and outpatient, but outpatient, we're really pushing to try to get the physicians to do more diabetes educator referrals so people will come into our program. So what are ways besides, going and bugging them monthly, that we could try to get them to support and get it into their routines and, their referral sets or referrals over to our program, something like that.
This is Jenny. I'm wondering also if there's a way, just examples of people who are partnering with specialists, such as ophthalmologists or podiatry. We're kind of looking at that a little bit right now, how to partner with them.
This is Roseanne. Along with that, one of the challenges of the current law is that if you partner, say, with a podiatrist that wants to refer someone, you have to actually get the referral from the primary care doctor, and that's one challenge that we're having, is that we have physicians that refer, and then we're having sometimes the primary care physicians not willing to actually provide the referral. So you've got a referral that you can't accept, essentially.
This is Lisa. I agree with streamlining inpatient to outpatient. We're going to start providing some inpatient services here. And then also, we would like to learn a little bit more just about some creative ideas for participant engagement. We're unique in that we are operating out of cardiac rehab, and we would love to talk about incorporating exercise into our programs, whether that looks like a support group or, if that's even a possibility, or if anybody is doing that.
Lisa, on that, that is something that would be interesting because if anyone lives up northern Colorado, there's a big conference at St. Joe's with Dr. Dean Ornish, and he has his cardiac program where they incorporate diet, exercise, and actually psychology. And is that something that going forward with diabetes programs, we could be a part of those type of programs, or kind of make a program like that for us where we could be kind of a wellness center where it could be exercise, meeting with a psychologist, diabetes education, nutrition, kind of all in one. That'd be really cool because he's had a lot of success with doing that with his program, but he's like a renowned cardiothoracic surgeon, so that might be kind of cool.
Yeah, that would be great. I think also it would help maybe with retention if people are getting exercise out of it.
What was his name? The doctor? Sorry. The cardiac doctor that you were talking about? Can you give his name again?
Oh, I think somebody mentioned Dean Ornish.
Great ideas, everyone. Just to take the last 2 minutes, I know we won't be able to fill in the rest of the topics, but for example, someone had mentioned a physician. So could he be a speaker potentially? Is he in Colorado?
Dr. Dean Ornish?
Yeah.
He is a nationally renowned cardiologist. Yeah, it would be amazing. He did just do that big conference at St. Joe's for cardiovascular. Obviously he's willing to do conferences and talks. I just don't know what the price point would be. Yeah. But it would be amazing because the cardiac rehab and then our dietitian in our program went to it, and they said it was incredible and it was super helpful, and they were telling me about the program, and I just got this kind of grandiose idea of wouldn't that be cool if we could pertain that with diabetes, because diabetes and cardiac rehab kind of go hand in hand. So it's kind of cool.
Yeah, so I'd love to, Morgan, maybe, this is Morgan, right? That's Morgan?
Yes.
Okay. I would love to have an offline conversation about that because with our 1817 grant, I know that numbers don't, a lot of people don't know what that means, and just for time purposes, I won't go into detail, but it's a grant that we have through CDC, and we have a strategy under there for cardiac rehab, and so I'm going to hold this idea, and I think that there's some great possibilities. So thank you for that, Morgan. So I'm going to circle back with you offline.
Yeah, that would be great because it was so exciting just to listen about it. And, you know, I'm not cardiovascular at all, but, I mean, it's like the perfect marriage, you know.
And that's the thing about this conference is that we're truly trying to cross-pollinate between our cardiovascular program, the programs that we support here at the health department, with our diabetes program. So it's just the evidence is more and more that that there's a strong connection between the two, and so we're trying to streamline our efforts here at the health department for those efforts. So we don't have a whole lot of time, but it would be great if you all could start thinking about speakers. If you know anyone in your system, your health system, or like for example, Morgan had mentioned a name, let Meredith and I know so I can kind of fill this chart out. That would be really helpful. You know, if you know someone that does something really well, or you've heard someone speak before, especially if they're local, that would also be great. We do have the possibility of maybe getting a national speaker, depending on funds, like we did last year with Marianne. We had the funds to fly her out. Also start thinking about materials. What I wanted to gauge was like, what do people like in terms of having something when you go to a conference? You know, do you like the materials, PowerPoint printed out ahead of time, or do you just, is that wasteful to you, or is there other materials that you find helpful that can support your program? And then kind of narrowing down, like, what is it that you want to learn after a session? Like, for me, like I like to be able to have a skill or something, a tool or something I can take back and actually work on. That's kind of my style. And so what kind of skills do you want learned out of some of these topics? So I may pull you back into this conversation via email to kind of fill this chart out if possible, if you're all okay with that, because we got some great ideas today. Meredith, do you have anything else before we move on and wrap up the call today?
No, just in general, great sharing and feedback with that session. That's really what we're out to achieve, is to hear from all of you on what your priorities are. So I love the depth and sharing that we had today. Thank you all. So our next steps, our next call is scheduled for November 21st, which is the day before Thanksgiving, which makes us wonder if it would be worth rescheduling or postponing. Do any of you want to speak to that? Do you want to cancel that call for November, or do you want to schedule it for an earlier date or keep it where it is, given the timing? Any strong feelings?
This is Roseanne. I think I would suggest one call to cover in November and December. And so either do it like the fourth week of November and then not do one in December, or else do it in early December and not do one in November. But those tend to be busy times, and sometimes people are taking time off. It just seems like it might be better to just do one call for the 2 months.
Yeah, good suggestion, Roseanne. Any other thoughts on that?
This is Morgan. I second Roseanne. Absolutely.
This is Yvonne in Trinidad. I agree. That would be a great idea.
This is Kathy.
I agree too.
Wow. We're nearly unanimous. Very good. Thanks for the suggestion, Roseanne. All right, and then those of you that have been joining us in the previous month, you know that we've been working on the provider satisfaction survey. That is still in the final stages of approval, with Marianne being involved in that. We just need to get her final sign-off on that, and then we are putting together a communication that will go out to all program staff, those on the call and those not on the call, that will have information on how to obtain that provider satisfaction survey and just some further thoughts for implementation and use of the survey. So we also have that going on. Always keep our slide here for related resources. The first one, the business plan guide, if you ever want to refer to that. We also have the great fortune of Becky Diorio at the state, who works closely with INCA, but specific to the diabetes prevention program. So if you have any questions or needs to that end, you can contact Becky. We still have free one-on-one technical assistance calls available with Marianne Hedorowitz, and that can span the spectrum from billing to starting a new program to a CQI project to marketing, really whatever your specific program need is. So we have that available through our Telegen contract through July of 2019. Just get a hold of me if you're interested in taking advantage of that. You'll see that the evaluation for today has been opened up. If you could please answer those questions quick before you exit. And there's the information on how to get a hold of Inca and I. Call or email at any time with any questions. And thank you all so much for joining us today and the rich conversation.
Thank you, everyone.
Thank you.
Thank you.